500,000 people a year in Australia alone are harmed by the hospitals they go to for help. They suffer from an avoidable critical incidence, of which over 95% have a communication failure component.
We are really at a tipping point in healthcare. What are we doing with COVID? How are we communicating? Talking about clinicians really deep in the weeds of relationships with patients.
We really believe that what was needed was for linguists, people who understood language, the outsider perspective, to come together with the insider perspective. So working closely with doctors, nurses, allied health to really work out what was going on, because the situation around the world is getting worse.
The challenges we face in healthcare are global, and therefore the best way to address them is to work collaboratively in the way that the consortium will do.
Obviously, illness and healthcare is something that affects people and that happens all over the world. I mean, the current COVID situation has really brought this to the fore, that what we all do in our local geographical contexts is really not independent from what other people are doing or should be doing.
We need to be able to understand that cultural and linguistic diversity. The International Consortium for Communication in Healthcare provides an opportunity for us to understand health communication in that international context.
One of the really unique things about the consortium has been the idea of linguists working with communication specialists, working with healthcare professionals, clinicians, physicians, nurses.
So it's really quite distinctive in terms of that interdisciplinarity. But it also bridges the divide between academic and practitioner worlds. So it's not language people by any means just working in isolation to try to impose what they think might improve communication in healthcare. We are all committed to applying the findings to practice.
The fact that we are able to then share that knowledge together, it allows us to kind of take the best practices from across the world and then apply it to our communities, our various areas of research, and to think about how they can be translated on a much larger scale. So it really kind of helps to multiply the efforts, right, of many of the scholars in the field.
We are bringing an amazing array of perspectives and understanding about health to the whole question of how do you communicate with patients? How do you translate what you are learning with the communication into actual practical care of the patient, training of people to care for the patient, and further research.
There are several projects that we've been discussing on end-of-life care, on mental health as it happens, on development of various apps, on telemedicine, and you could do a lot of work as an individual, but to have the support of the rest of the consortium is absolutely fabulous.
These are like-minded people who share our commitment and passion and who have the knowledge and expertise that we can learn from each other, communicating and learning about each other's research and finding and applications, but also opportunities for collaboration.
Everybody is absolutely at the top of their game, which means that we can really do things together. So my hope is that it can add value to everybody's research enterprises, but also create something that is much more than the sum of its parts in terms of what we can do.
I think we are on the cusp in healthcare where we can really move the needle. We can really make some changes.
There is no time, I believe, in our living memories that the need to do international collaborative work across borders is more essential and more important. So I think there's no greater time to launch the coming together of a consortium that is focusing on improving healthcare practice. I really believe that our collective vision will be able to help create a future in which healthcare is safe, compassionate, sensitive and supportive for patients, carers and clinicians.